Hey everybody, how you doing? Uncle Vinny here. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey, I'm Dr. Nick Circolone. You're listening to Health Chat. We're hanging out, relaxing, just doing our thing. I want to talk about low back pain and neck pain. And we had a caller last week talking about basically hanging himself from the rafters, which a lot of people, there's devices that you could do to do decompression, but there's a lot of patients that really can benefit from decompression therapy. And what decompression therapy is where we literally traction or use axial traction to traction the cervical or lumbar spine to decrease pressure around the joints, the facets, and all the things that are associated with that area to help relieve pain. And let me tell you something, Joe. I've been practicing now, we talked about this, 30 years, and I've been doing decompression. There was two people in Chattanooga that were doing decompression. One was a medical doctor, okay, and the other was me. So the two people that really kind of pioneered it in this area was myself and this other doctor. And I don't know if he's still doing it or not, but he used to advertise on the show and everything else. And we'll talk about
it. Was more big when you guys first started doing it.
It's still big, but people are paying an arm and a leg for this. And what we're doing in the office is, yes, insurances don't pay for it. But what we're going to do is it's just a little bit of an upcharge with your insurance. So say you have an insurance that covers, I don't know, your visit's $50. It's a little bit more than that you pay. You don't have to pay all of that up front. And I think what we're trying to do is we're trying to get back to that, because getting back to the basics and helping patients with problems that really are necessary. Low back pain, for instance, is, in the top 5 of disabilities in the United States. We were talking about that today. My back's hurting me from working on that deck. I've talked to people that were working on some stuff, and I personally get on those machines. So I don't have those machines just to give pay. I have it for me.
So you know how they work, you know how they feel and all that.
I love getting on that. And, truth be known, I think I bought it more for me than I bought it for my patients, because it does help. It makes a huge difference. I've had severe headaches from an accident when I was younger, and we talked about that before too. And I use cervical decompression, not like a collar at home. I literally go on this machine and I pull my neck and I just sit there for, a few minutes, and man, do I feel better. I want to go lay on it right now because it feels so good. I literally fall asleep on these machines. It's one of those things where you're so relaxed, it takes that pressure off, and it's almost instant relief. Now, there are times when I get off the machine where my back hurts a little bit more, but as I start to walk and as I start to move around, it gets much better and I feel much better. So it's just amazing. It's been one of those things that kind of fell by the wayside. Everybody's talking about regenerative medicine, and what happened to the good old low back pain? Let's work on some good old low back pain, because it does make a difference. And one of the reasons why I'm talking about it, Joe, is because I've been doing a new workout routine. I'm developing a new workout routine. And, I'm doing a lot of stuff that's like kind of bothering my back and my neck and everything else. And the new workout routine, you ready for the name?
Okay.
It's called Wreck It and Deck It.
No, I think I know where you're going with this.
I've been working on this deck at my house, okay? Everybody's like, why are you doing that, Doc? Why don't you just hire it out? There's something about just smelling wood and cutting.
Yeah.
I'm outside. Nobody's bothering me. I got my iPad, my earpods in, and I'm just like, this is fun.
When you talk about decompression therapy, that's very similar, in a different way.
And a little bit's frustrating, but it's been a lot of fun. So, but I'm carrying these huge timbers, And if you're in my age group, you realize this. Remember Rocky when he was getting ready to fight, which Dragon or the guy Drago. Yeah, he's running around the big things on top of his head, and he's doing push-ups, and I'm getting ready to do all of that. It's like fitting there, and I feel really good doing it. And it's just one of those things. But we were going to talk about decompression therapy as I digress. I always do. I have too much fun.
It's a good workout.
Yeah, it is. Let me tell you something. I did not realize how much a 6x6 8-footer was.
Oh yeah,
it's over 100 pounds.
That's no joke.
No, and I'm like, I picked that sucker up, threw it on my shoulder. No, I didn't. Anyway, I'm like.
After I cut it in many pieces.
No, I've been actually hauling them and throwing them around, the 8-footers. But as the week got better and as time has gone on, I could literally pick those up a whole lot better. A 2x4 about this big is easier, but I still.
I'll take care of those. You get the other ones.
For those people that just heard us and can't see us on Facebook, I just made a 2-foot, a 2-foot timber here. So we were talking about low back pain and neck pain, but decompression therapy, everybody knows it for low back pain. And it's one of those things where a lot of people have had, some of this going on where they're not getting any relief from their back pain. They're going to the chiropractor. They're getting injections. They're getting all this stuff. And decompression therapy seems to have helped a lot of people over the years. And when I was talking about earlier, it's Bill Moore Smith was the MD that did this. And then myself. We all did. I don't know who did it at the same time. Who came first? Either Bill or myself. But I know that we did it around the same time. Like within a month. We started doing decompression therapy, and I know he's had some great success for it over the years. He's still doing it. I still do it in my office. I recommend it for patients. But the thing is that when you go to get decompression therapy, a lot of people are being overcharged for it, Joe. Just like anything else. It's like, if I could charge you like $2,500 for 10 visits, I'm going to do that. And people are paying that.
Because they have no choice.
But it bothers me. Makes me crazy.
When you mark it up just because you can, that I don't like that. That's
it's like, I don't take your insurance, and here you are. So what we've decided to do in the office is I'm going to do decompression therapy. There is an upcharge for it, and I'm going to tell you what it is right now. It's an upcharge of $30. That's it. Okay?
It's not bad at all.
No. Now, you have insurance that will take your insurance, but that upcharge of that $30 is for the decompression therapy. You're still going to get everything in the office. We're not going to, I tried laser therapies. I've tried, some of the other modalities associated with it. Plain old decompression therapy with manipulative therapy on top of it is such it just hits home. It works, and it has been working for over 20 years. It's been amazing how much better patients have gotten. And there are times when I'll go, I don't know if decompression therapy is going to work for you. And I remember, I'm thinking back now at a patient, we're talking a while ago. This is when I was first starting. He did not know that I did decompression therapy. We don't advertise it in the office, and I don't hold it on the, I don't have posters out there, and maybe I should, but I don't. And he asked me, he said, I'm going to get decompression therapy, and it's going to cost me $6,000. I'm like, what? $6,000.
Wow. That's just for one?
No, not one treatment. This is for like a series of treatments. Okay. So you're getting a series of treatments, and we'll talk about that in a minute too, because some of this I don't understand. I do understand it, but I mean, people just like, they fall for this stuff. So he goes and he says, I'm going to do this. And I'm like, why? We'll do it right here. He goes, you do it? I go, yeah, we do it. I've been doing it forever. So he comes in, and I look at him, and I'm like, oh man, I'm not touching you. I mean, he was literally losing some motor function in his leg, which means like you could see where he was having a hard time kind of walking and was starting to get what's known as foot drop a little bit. I'm like, oh, I'm not doing this. Oh, there is no way I'm doing this. He begged me, Joe, to do it. Begged me. And I'm like, oh man, I really don't want to do this. And I finally said, okay, but here's the but. You have to get an EMG, you have to get an MRI before we do any of this. He was like, Well, they didn't tell me that they were going to do that at the other place. I was like, I'm telling you what I'm going to do because you have some neurological deficit. We need to check this out. Make a long story short, we did an MRI and the disc, literally, you could see. You don't even have to be a doctor to see this, Joe. You would look at that and go, "That's bad.
That's not right."
Yeah, that's bad." The two discs literally looked like they were touching in the spinal canal. The cord wasn't touched, but it looked like they were touching in there. That's how much extrusion of the discs there were. And I'm like, "Oh my gosh, what are we going to do with this?" And he's like, "Oh yeah, please." And I said, "Okay, if we don't show neurological deficit on an EMG, I will try it for a few visits." He was like, "Okay." So we did the EMG, and there was no motor deficit. You could tell that there was some sensory deficit, but there was no motor deficit. And I thought, okay, we'll try this. So we tried it once, and it was like, oh, this is uncomfortable, but I feel a little bit better. Well, he ended up having to have a lot of treatment for it. You know, he had about 20 treatments. Make a long story short, he's still a patient of mine after all these years, and the back pain is basically negligible. It's not even there.
Wow.
And I had to be convinced to do it for him. Like normally if somebody comes in, I do this stuff anyway. We do MRIs and we check all this stuff out before I even start to do this decompression therapy.
I was going to ask that question. Yeah. I just can't come in, "Hey doc, I want that decompression. Go ahead, let's fire it up."
No. The unless, and here's the thing, unless, and I'll give you the unless. If you come into the office and you have low back pain, we do an exam, we check you out, and I say, let's go. We're at least going to do an X-ray, of course. And I do an X-ray, and we find out that you have facet syndrome, which means it's the joints themselves. If the joints themselves are arthritic and they're causing inflammation, they're causing irritation, we can tell that from the X-ray. Plus the exam. If I don't have neurological problems where you're having shooting pain down the legs and into your foot and things like that, I don't necessarily do an MRI right away. I will say that. Now, if you have pain that radiates and stops at the knee, that's just classic for me to know it's a facet syndrome. And I will try the therapy. Now, here's the kicker. The therapies that they're using or have been using, and I'm hoping they're changing some of their protocol. The protocol was, it was half your body weight plus 10 pounds is the pull that you would pull on somebody. Think about that. So you're a 200-pound person. That means we're going to pull you at 100 pounds plus 10, which is 110 pounds. That is excessive. What if I have an older patient who is 200 pounds and I start pulling at that kind of weight? You're going to cause some problems.
Yeah.
You just will.
I'm not a doctor, but that even sounds like a lot.
Well, and it is, but now for me, and I've been doing it for a long time, my comfortable weight for me, and I'm about $180. My comfortable weight is right around like 75, 80. Right around there. Nothing crazy than that. Now, if it's sore, if it's stiff, no. Now, our poundage that I use on patients is really, really, it's not really low, but it's low. Give you a good example. I had another patient. I always talk about the patients because, I can talk about them because I'm not talking about their names, so there's no HIPAA. Had a patient come in, and we decided to use 45 pounds. You're going to go, 45 pounds? That's not a lot. I mean, guys are thinking, that's not a lot of weight. I mean, you could pull me more than that. We did 45 pounds. They were getting better. They were seeing improvement. So we said, okay, let's up it just a little bit. Let's go 5 pounds. So we went to 50 pounds. It caused so much pain and irritation. We had to drop them back to 45 pounds, and their whole treatment cycle, I think it was maybe 10, maybe 12 treatments, they ended up having to stay at 45 pounds. But they got out of pain. They were able to go back, and they were dancers, and they worked out all the time, and they went right back to doing that, which was amazing to me because we didn't pull it that much. So when we talk about weight and how much you're going to use, it's got to be specific for that patient. Not every patient gets the same thing. And that's the beauty of it. We don't want patients getting the same thing. We want them getting something that's different, that's suitable for them, and not that we do it for the same patient every way. We don't talk patients into getting it This is what we're going to do. And what I do is I don't sign you up for treatment. We start it one day at a time. So every treatment we try, we see how you're doing. If you're not improving, why should we continue this?
Sure.
That's my problem with these package deals that these people are getting into. What happens if you're going to do 25 visits? Now, I'm not saying you cannot get better in 25. Yeah, sometimes it takes 25 visits. I'm just going to say that. Sometimes it does, depending on the patient. But what happens when you pay all this money up front and you're better in 4 visits? Do you get your money back? Like I don't know that. Because people are signing contracts. I've seen the contracts where they're signing contracts to say, "Hey, I need to get this treatment. I'm going to do this treatment for 25 visits, and I'm going to commit to this for 25 visits. You're going to pay the money, so you're going to go for 25 times. What if you're better in 4? Think about that. How would you feel if I told you, all right, I'm going to need $5,000 up front for 30 visits or 25 visits?
Well, one of the first things I would ask is, well, what if I don't need all those visits?
Well, we recommend the 25 visits.
Okay.
That's exactly what I'm telling you. Stuff the patients have told me. It's like because I said the same thing. What if you don't need 25 visits? Well, this is our protocol. 25 visits, which means every single patient that has low back pain is going to that clinic and going to get 25 visits, regardless of their age, regardless of their symptoms, regardless of what's causing the problem.
Yeah, I mean that's one way to guarantee that $6,000 or that $5,000, whatever it may be.
But that just doesn't seem right to me, Joe.
No. And why not just break it down per visit?
Yeah, the visits are expensive, and I know that they're expensive. Even when you have to pay with insurance and $30, it's still not cheap. You know what I mean? Sometimes your deductible is not met, and you have to pay your deductible. So you're still shelling out a lot of money.
Sure,
comes out to less than $100 a visit, but still. Joe, like I said, informing and entertaining.
There you go.
We were talking about back pain, and we were talking about decompression therapy and how important I think decompression therapy is, and what a vital modality it is. But you asked a great question. It's like, when do I go to a chiropractor? Like, why should I go? And a good, let's say low back pain. If you have low back pain that lasts more than a couple of days, you might think you're going to seek help for it. If you're thinking about, hey, this is bothering me, I need to get this looked at, chiropractic's probably the first choice that you should have. If you don't want, if you go see a medical doctor, they're going to give you an anti-inflammatory, muscle relaxer, send you out the door. You'll feel better in a relatively short period of time, honestly. But you're still going to have the damage that's there. Whereas with manipulative therapy, and I say manipulative therapy, and I talked about that last week, there's a lot of people do manipulative therapy, a lot of professions. Your DOs, your DCs, your PTs, they do some form of that. But what I'm saying is that if it becomes a chronic condition, then we start to have an acceleration of degeneration, and that's what you don't want. So if you're a sports player, excuse me, I didn't mean to do that in the mic. If you're a sports player, as well as I do, Joe, every sports team has a chiropractor on it.
Yes,
they do. We don't have them on teams yet, which we should. Like I said, I was the lookout stock for a long time, but you need to have them on the local teams, or at least have access to them. I see a lot of young football and baseball and soccer players and volleyball players. I see a lot of young patients that we do that, and we talked about that before too. But it's one of those things where if you're thinking about going to chiropractor, that's the first decision. The second decision is to find somebody that knows what they're doing. Like, don't go just to go to a chiropractor. Like, don't pay the $29.95 Earl Scheib, just me, send me out the door, because that's not the kind of experience you really need, especially for your first one. or look on YouTube and go, oh, I want to go to the guy that does the ring dinger or the Y strap or he does the hemorrhoid removal move or something. You know, I just
It's the wrong office.
There's actually something there. We'll talk about that later. There's a technique that they talk about, but we won't talk about it today. So, but anyway, so if you're thinking about it, look for somebody that's been practicing for a long time. Number one. Number two, where they've gone to school. I'm a big Palmer graduate, you know, and I'm big about Palmer. I didn't know there was a difference, but there is a difference. Palmer is like the best. I'm surprised the phones don't light up. Go, no. But we are. And the other thing is that what kind of experience do they have? Number one, where they go to school, and number two, do they have advanced degrees and such as I do, and in orthopedics? So that makes us different. And that's what you want to look for. You want to look for somebody who's reputable, treat you as a doctor, and ready to be able to help you and get you out of pain and back on the track, and not necessarily seeing you, you know, every single day for the rest of your life. Listen, chiropractic is a lifelong thing. I do it. I like to get adjusted at least once a month. You know, if I could get adjusted, I told you every week, I would probably do it because I feel better about it. But I wouldn't do that. But at least once a month, just keep me going because I'm working out, I'm exercising, doing other things. I'm doing heavy things. So, you know, chiropractic is a really, really good choice for you. But finding the right one, going to the right one, those are the important things. Joe, it is the top of the hour. Do you believe how fast this was? We were all over the place today a little bit. We were still talking about low back pain, but it was fun. It's always fun. I enjoy this.
Yes, sir.
I enjoy being with you. You just make it easy. We were talking about maybe doing this like remotely from the house when I'm out of town. So we're going to see what's going on there. But guys, it is the top of the hour. The show is over. I'm sad. I'm crying a little bit here, but we'll be back next week. Have a great week. We'll see you next week, and God bless.